Aria Dermatology and Aesthetics is recognizing Skin Cancer Awareness Month, and while everyone should get their skin checked, some groups are at a higher risk than others. So Kenny's learning more with Dr. Victoria Moss.
All right, May is Skin Cancer Awareness Month, so we're hanging out here at Aria Dermatology and Aesthetics with Dr. Victoria Moss. Dr. Moss, I want to talk about who is at risk when it comes to skin cancer, because I think a lot of people, they might not know that they're at risk.
Yeah, so I think that there's several criteria that we talk about. I think it's a good thing for everybody to get a good baseline skin check because you don't know what you don't have. But people who are at higher risk, so people who have fair skin, so blonde hair, blue-eyed, but anybody really is at risk for skin cancer. I've taken skin cancer off of all skin types.
Wow.
People who have a personal history of skin cancer actually have a 40% chance of growing another skin cancer in the next several months to years. If they have a family history of skin cancer, I know we also mentioned previously that having 50 or more moles does put you at a little higher risk. And I think the other big thing is risk of or history of tanning beds is also a big thing, and if you've had a bad sunburn in your past.
Okay.
Yeah.
So when should people get checked?
Yeah, so again, I think it's always great to get a good baseline check, especially if there is a personal or family history. And then depending on how many spots you have or the types of spots that you are, as dermatologists, we can kind of give you a better gauge of how often you really should be checked. Sometimes it's every 3 months, sometimes it's once a year, sometimes it's in between.
And honestly, if you're feeling like something is, a little funky, you should just go in anyways, right?
When in doubt, get it checked out.
Get it checked out.
No question.
Definitely.
Yeah.
All right. Talking about May too, you're seeing probably a lot of people come in for, skin checks and stuff like that. How easy is the process when someone gets in? Kind of explain to us what you guys do for a skin check.
Yeah, so we try to make it as easy and as painless as possible and try to put people at ease because I know that it's an uncomfortable thing for patients. We put you in a gown. We pretty much look from head to toe and everything in between. So I usually will start at the top and I will kind of look through the hair. We are going to take a really, really good look with something called a dermatoscope. Gives us a much better idea of what's going on underneath the surface of the skin and not just on the surface. And then we just kind of take a good look at everything from head to toe.
Yeah. Okay, say you find something serious. What are the next steps after that skin check?
So it depends on what it is. So sometimes it can be something like a pre-cancer where we're actually able to just treat it right on the spot. There are some things that if we are concerned that it could be a skin cancer, usually our next step would be to do a biopsy of it and we would submit that to pathology. And that can be done the same day as a skin check.
Okay.
Yeah.
I love it.
Yeah.
All right, where can people get in touch with you to get their skin check for May?
Yes, so you can call 719-377-3727.
Perfect. And Aria Dermatology is just located in northern Colorado Springs, too.
Yes, we're in Northgate.
All right, thanks again, Dr. Moss. Your expertise is always the best.
Thank you.
Great tips and tricks we can use ahead of the summer months. This segment has been sponsored by Aria Dermatology and Aesthetics.